Celebrating 50 years of service to the Kenosha area in Wisconsin, the Hope Council on Alcohol and Other Drug Abuse is the little agency that could, maximizing impact with a modicum of money and manpower. Through the work of its staff, volunteers, board of directors, donors, and partnering agencies, the Hope Council strives and succeeds in reducing the impact of alcohol and other drug abuse through education, prevention, intervention, and referral services. The work benefits not only those afflicted with substance use disorders, but also their loved ones. The agency reaches out to youth as early as kindergarten, giving them the tools to deal with the pressures of substance abuse when they may occur in their lives through their own use, but also due to that of a loved one. The Hope Council serves people of all ages and backgrounds with resources toward better decision-making and social behavior. In this program, you'll hear from those who have benefited from the work of the Hope Council and from those who have served and continue to serve in leadership and support roles for the betterment of our community. Their stories paint a picture of the half-century of compassion, vision, and direction of this nonprofit organization. We thank you for watching and ask that you spread the word about the work of the Hope Council on Alcohol and Other Drug Abuse and how it may help now and in years to come.
There are few among us whose lives have not been touched by addiction. For the past 50 years, the agency now known as the Hope Council on Alcohol and Other Drug Abuse has been providing a light for people and their families seeking assistance. I appreciate the partnership Kenosha County has with the agency and how it has made a difference for our community for 50 years. Thank you for giving the citizens of Kenosha County hope.
Well, my involvement with the Hope Council goes back to really my dad's involvement years ago. He was on the original board of, at that time, the Alcohol and Other Drug Abuse Council, I think was the name of it. He was involved for many years. He was a personnel manager at Mac Whitewire Rope, and so he referred a number of people for assistance and help, and he always talked about how responsive they were and how beneficial it was to have this type of an organization in the community.
My wife was a registered nurse. She had worked in the detoxification unit at St. Catherine's Hospital in the late 60s and early 70s. And she became acquainted with Robert White, who was the original executive director of the Alcohol and Other Drug Council. It was established in 1969. Bob was the executive director for, I believe, 15 years.
Well, sooner than later, Bob began to look around the community for the resources to deal with addictions, especially alcohol and drugs. Bob discovered that most of the industry had no formal employee assistance program. Bob got an Episcopal priest at St. Matthew's interested in the problem with alcohol. And he got him to open a halfway house. And I'm sure it was Bob's influence on that priest that got the church to buy the property and to start a halfway house.
It's also acted as a launching pad, if you will. Some of these names might be familiar to you, some might not. But if you remember the old Weybridge House, that was the first residential halfway house for persons recovering from alcohol and other drugs. If you remember Meridian House, later became Interventions. It was the first residential therapeutic community style, a la Synanon, program of that nature. What the council did is took the nucleus, the pioneer workers for Weybridge, for Meridian House, took them into their fold, under their wing, and allowed the resources of the council as an organization to be the conduit so that the Weybridges and the Meridian houses could grow.
I was hired back in 1989 by Ted Rosengren, and I worked until 1999. And it was really a tumultuous time in Kenosha's history. You may remember in 1989 that the Chrysler assembly plant closed down, and this was quite a hit to the community. And while it was devastating, and I think the community went through some tough times, it also afforded an opportunity for nonprofits to find grant funding and establish new programs. And that's exactly what we did back then. We initiated the FAST grant, Family and Schools Together, with, I think Pat Demas headed that up.
First of all, I want you to meet 4 little puppets. They were part of what we called the BABES program, Beginning Alcohol and Addiction Basic Education Studies program. This program was geared for children ages 4 through 8. It's a 6-week program, and it talks about life skills, how to make good decisions, how to build teams and work in teams, what to do to make healthy choices. And they display that through storytelling every single week. At the end of the stories, at the end of the 6 weeks, we had a celebration, and many times the children would tell a story back with the puppets. It was a very successful program, and to this day, people will still stop me and talk about how powerful and how impactful this was with their child.
I have the great fortune of calling Dick Griffin my stepfather, and many of you who know the history of the council will know that he was one of the first employees of the Hope Council. He also was very active in the community of recovery as a person who had 42 years of sobriety when he passed in 2010. He also served as a board member for the Hope Council and dedicated a lot of time to the Living Free program.
I think the biggest impact of the Alcohol Council, the Hope Council, on the community has been in its relationship to people and how it has helped people and families to address this issue, which affects so many people.
The people that I got to work with became a huge support system for me on my path to recovery, and started in about 2016, and I still remain in contact even after everything has been said and done, so which is extremely helpful. Now sobriety has been since October 24th, 2015, with the help of Hope Council.
And I just have to say it's had such a positive impact on my life, because I never thought that I was going to learn like integrity and professionalism and have that be a part of my own recovery, and then be able to give that back to the community, and on a community spectrum be able to add positivity to other people. And I just think that as a part of the Hope Council, we so diligently try to give that back. And it's been my stepping stone to so many wonderful things, and it's like my home away from home. You know, on a down day, it's literally given me hope. On days when I thought I wasn't gonna be able to go the distance, you know, I come there and it gives me the reasoning to carry on.
I had gained guardianship over my nephew a few years back, and our family was looking to reintroduce his father into his life, and at the behest of counselors, it was appropriate to do that. So we engaged the Hope Council in doing that, and it resulted in positive reunification. He has been with his dad for over 6 years and hasn't needed our intervention again as guardians.
I've been the executive director at the Hope Council for the last 10 years, and I'm so proud of the agency from the perspective of how it helps the community. Today we have 11 employees. And that varies, and so I really consider it the little agency that could. We're the only agency in all of Kenosha County that specifically addresses only substance use disorders. And because we're so small, we're also very mighty. We're able to implement programs very quickly. We're able to change scope. We're able to move things around. And because of that, we can serve the entire community in so many ways.
A couple of years ago, I began to see a dramatic increase in the number of opioid-dependent folks in our criminal justice system. And it was affecting everything from foster care to the kind of cases we were seeing in terms of armed robberies and burglaries. And I went around the community and was sort of looking to see who else was sharing this experience that we were going through a crisis. And lo and behold, I found that the Hope Council was already talking throughout this community about the impact that the opioid crisis was having here in Kenosha. Guida Brown, who is the executive director of Hope Council, was already going around our community, speaking to community groups, and in her capacity with Hope Council was trying to educate the community really person by person, group by group. I really believe Hope Council was the beginning of this community really coming to grips with the dimensions of the opioid crisis. I think we're really on a lot of levels, really meeting the challenge of the opioid crisis in Kenosha now, and I really credit Hope Council with being at the very vanguard of the community education that was necessary before we were prepared to do what was necessary to try to combat this crisis.
I think it's important for people to realize that alcohol and drug abuse is a plague on our community and on our country. And it's something that needs to continually be fought. But fighting it doesn't mean necessarily putting everyone in jail. It means working with people, giving the education that they need, working with individuals to make sure that they have an opportunity to have a better life. And I look at the Hope Council as an entity that does that. They're there to make sure that people have a chance, but it's not a simple task. It's not a simple task that someone just comes in and says, well, I want to take care of my problem and you're going to fix it for me. Not how it works. They're tough. They do what they need to do to make sure that individuals move forward and live by a standard that is going to be acceptable to the public and to themselves. And I think that's part of what Hope Council does. It enables the individual to become a better person. It is not a simple fix. It will take time, but it's because of the Hope Council that there is hope in the community for those who have these problems.
I'd like to thank Guida Brown and the Hope Council for being a great resource to me personally as a legislator on these important issues. But more importantly, I'd like to thank Hope Council for providing just that, hope.
I certainly congratulate them on 50 years and certainly expect many more years of success here in the community.
So I thank them for their years of service and really for all of the very positive and essential missions that they currently are involved in our community.
I think the Hope Council does a wonderful job, and I'm so proud to be associated with it and with the staff and the people of it. And all I can say is happy 50th birthday.